Everyone, I'm Dr. Muhammad Hassan Amjad. I'm from Sangangaram Hospital, Lahore. And today we're going to talk about the diagnostic yield of stereotactic biopsy using half-arc ZD frame system for deep-seated brain lesions. Well, as you all know, the indications for stereotactic biopsy include first is the biopsy of the deep-seated lesions, aspiration of the cyst or hematomas, staging of the neoplasms, and also for the placement of Ommaya reservoir or intraventricular catheter in cases of benign intracranial hypertension, and also for functional neurosurgery, including lesioning and DBS. A little bit from the history, stereotactic biopsy were first introduced by Spiegel and Weiss in human beings around 1947. They developed a Horsley-Clark frame that was first one to be used, which was based on Cartesian system. It was introduced around 1950. Lexell then brought upon a revolution and they incorporated polar system into the system, and their full arc frame system was first used around 1955. Since then, multiple advancements have been made, and now we have developed half arc frame systems. Few examples of full arc frame systems include Lexell frames, RM frame by Amjad, and CRW frames. And among half arc frame system, we have ZD frame, Zumrano-de Giovanni frame system of Amjad. This one is a Lexell full arc frame system. This one is an RM, and this one is a CRW full frame. As it is clearly evident that these frames are very bulky and heavy and with complex machineries. This half arc frame system is apparently very easy to use with few mechanics. So after choosing our patients, we place a head ring on the patient, which accompanies the frame, and the patient is placed in the, for imaging, since it's titanium, it can be CT or MRI. And this is the frame. After getting our images, we transfer them into the computer system, our IPS. It's very simple to use, software is very easy to handle. You just mark the lesion and the entry point of your entry point for the biopsy. After marking your entry and target, it just gives you the simple calculations. It shows an average error of 0.26. It's acceptable up to 0.3 in that system. These are the calculations that are given by the software. As you can see, it has values for target lesions as well as values for the mounting arc. So this is a phantom frame. One of the most beautiful feature of this frame is the availability of phantom frame. After getting your lesions, this is the head frame and these are the different biopsy needles. This is the complete setup, the arc systems and the biopsy needles. The best point of this system is the availability of a phantom frame. After getting your target values and your arc values, you apply this on this phantom frame and make sure that your points coordinate at the similar point. The bigger needle points the target lesion, while this is your biopsy needle. That is why it has an accuracy of up to 1 millimeter. So after this, the frame is removed. The head ring is set in place. Patient is set for biopsy. Now, since you have already calculated the lesions of the frame, the arc, you just remove it from the phantom frame, and this pre-calculated frame is mounted on the head ring of the patient. This lets you give lets you take the biopsy of the patient. One of the best features of arc system is that you can manipulate your entry point since it's center based. So you can change your entry point, but it will always mark towards the lesions. A simple burr hole is placed and biopsy is taken. The objective of this study was to assess the diagnostic yield of stereotactic biopsy for deep-seated brain lesions using this Amjad Zumrano-de Giovanni half-arc frame system. We performed a retrospective case series. We included 16 cases from January 19 to January 2020. However, we got slowed due to COVID. We could only include 16 cases in that, and histopathology was used for the assessment of the yield. 10 of our patients from 16 patients were female, while 6 were male. and our biopsy results were 100% positive. All 16 patients were showed positive biopsy in our histopathology. So in results, we used 16 cases of supratentorial brain lesions. Biopsy was positive in all of our cases. Only one patient developed a small intracranial hematoma at the site of lesion, but it was managed conservatively. Patient did not develop any morbidity or any deficit later on. There was no post-op infection noted. We found a study that showed that was a case series of 421 cases. It was done in Rome. It was done over 16 years. And they showed that they increased their yield by the use
2 minutes.
of... 2 minutes. They showed that their yield only improved after the use of intraoperative frozen sections. There were other studies cited in this cited for this that showed that almost all of them improved their yield by introducing intraoperative frozen section and histopathology analysis. There was one other study that also used similar ZD FARC frame system, and they used intraoperative MR scanners to improve their yield. And they noted that after the incorporation of intraoperative MRI, their biopsy, their yield only increased by 0.8%. It was 96% without MRI and 96.8% with the use of MRI. So in conclusion, it is our ZD frame, animated xeno frame system is one of the easiest frames to use. That's why it's also known as lady frame. It has 100% diagnostic yield, less bulky on the patients. The software is very user-friendly. You can get CT or MRI and they can be merged to get a very good 3D view. It has built-in atlases that are particularly very helpful in cases of functional neurosurgery. And one of the most prominent and most beautiful feature of this is the availability of phantom frame. The availability of phantom frame let you check and let you verify the accuracy of their targeting before you proceed onto the patient. So you do not have to repeat for biopsies and only one is enough. Thank you very much.